The Council of Governors wants the National Hospital Insurance Fund to be led by a professional institution which is competent to manage the fund rather than having the fund run by a CEO and a board. On the other hand, the Kenya Medical Association says that for quality assurance and quality healthcare, there is need to involve stakeholders to ensure the standards of healthcare are maintained as per the existing policy under the Ministry of Health. Helen Aura explains.
With slightly over 25.36 million Kenyans above the age of 18 enrolled to the National Hospital Insurance Fund, the Council of Governors is now proposing the need for the resources under the national insurer to be handled by a professional institution to enable transparency and accountability of the funds.
Kenya needs to establish an insurance bank to manage NHIF funds. This must be created by further amendment of the current NHIF bill.
On the other hand, the Kenya Medical Association, through a written response, added, and I quote, "A properly constituted board of management that will address the governance and accountability issues in NHIF suffices. This needs to be complemented by a component secretariat to ensure the technical matters are handled professionally. We agree that NHIF should limit itself to social insurance issues and should be regulated by the IRA."
The informal sector is the first sector that needs to be covered. I think the formal sector needs to pay more to cover the informal sector. I mean, there's a disparity from who the real poor are.
The Council of Governors further recommends that primary health care to be financed and anchored on community health leadership structures.
There needs to be community participation and ownership in the structure and functioning of universal health care. The current structuring of NHIF has no community ownership or role component. It therefore cannot be able to effectively collect finances from members outside formal employment and will not properly finance the community health systems.
Kwa hiyo mambo ya NHIF wajaribu kurudisha kiwango ili irudi chini, hata wale wako na mpango the lower incomes wanaweza kulipa kwa urahisi.
But KMA holds that this should not be the primary focus, further saying, agreed, but should not be the primary function of the fund, as grants from the Ministry of Health and allocation to the counties should be used to ensure that we have proper infrastructure and requisite HRH to deliver UHC. Both parties are calling for the adoption of the NHIF bill in order for UHC to be rolled out smoothly. This comes as NHIF announced reduction of certain health services, a move which will see the Monanchi have to dig deeper into their pockets to cater for the cost of health. Helen Aura,